Well, this is an ultrasound study of a 40 years old female presenting with the history of unexplained anemia, and no ultrasound has so far been performed, and neither has been advised to her. Only transfusions are being given. There is no para-aortic enlargement, lymph node enlargement, though spleen is also normal in size. Kidneys are normal, both kidneys are normal. This is a bird's eye view for this is the kidney liver, both are normal. This is the gallbladder, normal. Now, as I come from the region of the left upper abdominal quadrant, when I move the probe transversely downwards, and here at the lower abdominal quadrant, I see an heterogeneous mass with having mixed decoys. This is the transverse section, and this is the lower abdominal quadrant. Okay. Now this is the longitudinal section, and what you will note is that the iliopsoas muscle courses posterior to it. This is the iliopsoas muscle, this one, and this is the mass. This is a bowel-related mass in the region of the right lower abdominal quadrant that measures approximately, थोड़ा इंतज़ार करो जी। Now this measures 6.7 by 2.9 by 5.4 centimeter, and this is a bowel-related mass. This area that I have marked, it is the bowel-related mass in the region of the right lower abdominal quadrant. It's intraperitoneal, not subcutaneous. This is the subcutaneous line, the peritoneal line. This is the subcutaneous tissue, and here starts the mass. This is the mass, and this is the peritoneal lining. So the peritoneal line is not being disrupted by this solid mass. The walls are blurred. See, I am focusing only the area of interest, that is the mass. Hard, soft, hot. It's hard on palpation. I doubt anyone has palpated even. Now these are few ecogenic areas interspread within this mixed solid ecogenic mass in the region of the right lower abdominal quadrant. Whereas this is the longitudinal section. There is a fluid pocket also seen within it. Now this is a small fluid pocket seen within it. This area shows the fluid, and these are the bowel mass. In the region of a right lower quadrant, abdominal quadrant. Okay, now this is a magnified view in front of you. This is a small, there are a few small ecogenic areas with the peritoneal line. This is the one in front of you. This is the second one below it. I have magnified it to the maximum on this machine. So this is the second one. You see, this is either peritoneal mat or a lymph node, adjacent lymph node. There are two now. Now this is inside the mass, area of the mass. This is all mass. You are seeing all mass, and this area is either a peritoneal mat or a lymph node, and you can see it's disrupting the peritoneal line, and these are the dimensions: 2.1, 1.3 this one, and 2.0 by 1.6 the second one. Now with normal magnification, what do we see is again region of the right lower quadrant. Well, this is the here we will see the right iliac vessel there, and left iliac vessel. This is the left iliac vessel, and the mass is anterior to it. So this is a bowel, most probably this is a bowel related mass with peritoneal mats. These two areas. As when I move the probe, I give the probe a full sweep, they do not change their shape. Now these three are suspicious of being either peritoneal mat or allied lymph nodes or adjacent lymph nodes to the mass. This is our case of the day. Thank you very much.